Thank you so much for joining me today. Today we're talking about building transforming healthcare system. This is a detailed course and I would like you to take a listen properly. It must be considered that there's nothing more difficult and more doubtful, more dangerous than to initiate a new order of things. This is Niccolo Machiavelli. To talk about building transforming healthcare system, the WHO has 6 building blocks for building solid healthcare system. They spoke to healthcare finances, healthcare workforce, information and communication system, leadership and governance, medical product and technologies, and then service deliveries. If you look at that, everything would be incorporated under these 6 areas that we will be discussing. But the first model I would like you to embrace is the transformational leadership model, and that will be for module 1. Under this is the first section. So for module 2, it will be systems thinking and strategic design, where we would go into details about what a system looks like, what system thinking is, complexity thinking, and then design thinking for building strategic designs. We'll talk about system performance capabilities. That is where I would go into details about healthcare quality, patient safety, and performance improvement. And then socio-economic value created. I would speak to digital transformation, value in healthcare. That's accountable care in this case, where we're accountable to the cost, accountable to the patient, accountable to the system, accountable to all stakeholders, accountable to regulatory agencies. And then for system uniqueness, we will talk about culture of excellence, institutionalization of quality in healthcare system, and how to brand your healthcare system if you are a proprietor. And then for direct or indirect noble impact, this is where we'll talk about scaling whatever impact you have, expanding the impact, and ensuring sustainability. So this is like an holistic system that we're trying to build, and I would like you to stay with me. So I would like to talk about the story of transformation using 2 stories. You see, qualitative explanation of ideas and taking the forefront of building systems, especially when complexity is a crucial one. The first thing I would like you to get is the story of a boy who cried wolf. There's this popular fable of a boy who cried wolf, right? The boy was kept at the extreme part of the community. He was supposed to be in charge of the wealth of the community, and in this case, the wealth of the community is a large farm where there are sheep, and the boy is supposed to monitor them. He's supposed to feed them, he's supposed to take care of them, he's supposed to make them grow so that economically the community can make wealth when they trade off those sheep. So this is the challenge. The boy got bored, or the immaturity of being a boy just caught up with him, and he ran into the community the first time saying there's wolf. The villagers, the people, the elders came around, they didn't find any wolf, so he told them it's a joke. The second time he did the same thing. By the 3rd time, when there was actually a real wolf, the boy ran to the community crying for help. No one responded to him. This brought about the idea that, of course, generally you will say it's just a boy. Why couldn't they even give him a benefit of doubt the 3rd time? But the problem is not the focus on the fact that they couldn't give the boy the benefit of doubt the 3rd time. The focus for me is, why would you keep a boy in charge of your socio-economic building system? If you have a community and this is where your wealth is coming from in the community, why keep a boy in charge of that? So my challenge is the focus is on the boy. My challenge is the focus is on immaturity. My challenge is that the focus is on an untransformed mind. How did we allow socialized mind rise up to leadership? How did a community allow a small boy to lead their, maybe if I can call it, their national wealth system? So if healthcare is so important to us, why would we allow boys to be in charge? Why not allow matured minds? Why not allow trained minds? Why not allow transformed leaders? Leaders who have demonstrated high level of character, leaders who have demonstrated high level of competence, leaders who have demonstrated high level of compassion, leaders who have demonstrated high level of courage to transform society, and especially leaders who are consistent in the way they do things. This is actually the pain that keeps getting to me every time I go on an evaluation visit or an assessment. I see systems And I understand that the gap in this system is simply because there are people at the ends of affairs who are boys. And I need you to understand what I'm saying. I would also like to use the second story, the boy who throws tantrum, to explain it a little deeper at a more personal level. The first one involves a community. Why would a community allow a boy to rule over their national cake, right? But this concept of the other boy is just a young boy who throws tantrum generally. His mom knows about it, and they've been trying to cover up for him. So the first time he went into a store, he threw a tantrum, broke a bottle of wine, and they paid maybe $750, and they took the boy home. The next time, the boy went ahead and eat someone. Upon eating someone, of course that's an assault charge, and then it later became that the next time the boy is going to cause trouble with his tantrum, he actually stabbed someone. And at this point, it became an issue of the law. You should expect more from that. And it was like an irredeemable scenario because that has to come on his record. This is what I'm saying. At the first time when he threw the tantrum, all they needed to do for him is to get him into a structured system that will walk him out of managing his anger issue. If you put people under mentorship, under disciplined system, you can help them grow from being a boy to being an adult. If you put people under a formal, well-structured, transformational leadership or learning kind of system, you would be able to help them into transformation. So, if you integrate training a boy and then bringing him into a system and making him lead your national wealth initiative, then you would understand why I say the story that depicts transformation at personal level, we need to work on everyone. At system-based level, we need to ensure that it is only transformed mind that makes it to manage our system. That is very important to us. If we talk about transformational leadership, I would like us to take the story of Don Berwick. This is a popular story. He had told us this story himself. I was with him in Durban in February 2018, and he also shared a bit of this story. His wife, Anne, had a rare autoimmune disease and was being taken care of at an hospital. Don himself is a trained physician from Harvard, and he was surprised at the gap that he found in the healthcare system that was supposed to take care of his wife. There was a time a drug was prescribed, and for more than 60 hours, the drug was not made available to his wife. Many a times they forgot his wife on the gurney and left her scared. And so he saw the gap. He told us himself, he said, before I was concerned, but now I am radicalized. I want you to know that until I am able to move you from the point of being concerned about the healthcare system to transforming your mind to becoming radicalized, what I'm saying is this: until I'm able to move you from thinking, that's philosophy, to ideology, for you to believe in the cause, then I've possibly not done a good job today. So my idea and ideals for helping you to move and to help system as a transformational leader is to support you to move from just being a boy to becoming a matured mind. And just take a listen more, you would understand me better. You see, the healthcare system is plagued with a lot of fragmentation, and there's simultaneous explosion of knowledge in healthcare. This comes with a lot of complexity and requires leaders to do more. Jeff Sutherland is one of the co-creators of Scrum. He said something that hits me in his book. You can see The Art of Doing Twice the Work in Half the Time. He said the way the world works is broken. And I couldn't agree more, because the healthcare system is a complex human system. It is embedded in a larger complex adaptive system. As it is in the complex adaptive system, that means there is some interdependencies from the larger global complex adaptive system. There's some interdependencies with the complexity in healthcare itself. Do not forget that in every system there are stakeholders, and those stakeholders have their own power structure, they have their own economic and political structure that drives that system. And you must understand that they will come with their own opinions and interests, and this will really drive a whole lot of difference in the way the health system works. So if we know that the way the world works is broken, then if we find examples of transformed system, then we need to raise it up. I want to start with an example of Tedecare. Tedecare used to be called United Healthcare, and as at 2002, you will be surprised. The health system of Tedecare became one that has to be reckoned with in the nation. Importantly to note is actually the words of Kate Livingston. She said, the transformation of Tedecare, although it was powered by integration which comes from health information technology, but look at our statement. He said it is more as much a technological achievement as it is a model of leadership commitment. What I want you to get is that it takes leaders to know that there's problem, to identify problem. It takes leadership to do a root cause analysis. It takes leadership for you to analyze the problem and bring about intervention. It takes leadership to know how to key this intervention into strategic commitment that will be communicated to the frontline workers, to everyone along the chain. It takes leadership to know what to do. That's implementation science. It takes leadership to do exact evaluation. I would also like to take the example of Baylor Scott and White. In many years ago, they came up with Vision 2020. By the way, Baylor Scott and White is the largest not-for-profit healthcare system in Texas. It established Baylor Scott and White Quality Alliance. The Quality Alliance was responsible for accountable healthcare, and the goal is that they must embrace accountable healthcare, which drives clinical integration to ensure that the right patient receives the right care, and more importantly, at the right time, at the right place, at the right cost, in a connected manner. If I break down these sentences, these are the challenges that are plaguing healthcare system. You would understand that there's the issue of clinical integration, right patient, right care, right time, right place, right cost, and in a connected manner. It's no news that the cost of healthcare keeps expanding, and even nations that commit so much to healthcare are not having equivalent or equal responses in terms of the outcomes or the experience of care that people are able to enjoy, especially at the population level, where we talk about the per capita cost of healthcare. So looking at this, you would understand that there is a lot going on in healthcare that requires that you need to have a sound understanding of how to build transforming healthcare. I want you to know that this is a complex adaptive system. It is still being subjected to further research and development. There's still largely a lot of unknowns. However, the more you know, the more you are able to build or transform your system. And that is the goal of this class. So, if we go ahead, I want you to note that the healthcare system is a continuum between the public health, preventive healthcare, and the medical care. Now, of course, I can break down the medical care into three parts. You have the curative part, you have the management of chronic diseases, and we also have the rehabilitative part. So, our major challenge is that the healthcare system is a part of a global system, and so we have challenges from global to national, from national to subnational levels, to societal level, to provider levels, and then family and patient level. This throws us into a complex adaptive system in a complex adaptive system. Now, that should not get us worried. We are not the only one under a complex adaptive system. Nuclear reactor system is also a complex adaptive system. You need to see a lot of interdependent agents that are working. You need to see distributed control and non-linearity of outcomes. But for me to make you understand these three components, because this will go a long way to guide our thinking as a leader. The first thing you need to get is that when we say interdependent agents, it means there are so many independent variables that can stand on their own. So in terms of healthcare, you can have the physician group on their own. You can have the provider system, the administrators, the payers, that's the insurance system. Each one can stand on their own, and they have to now interact together. If you do not integrate them together in a well-coordinated manner, you will see silos of activity that will not be able to flag risk at the early onset, and then you will run into a lot of risk, a lot of assumptions, a lot of issues, and you will be working with a lot of dependencies. But guess who gets to suffer? It's the patient, of course. It's the patient and their families. They get to suffer through these risks. And the second part is distributed control, because each one has his own administrative head. So let me give you an example. Radiology unit has its own administrative system. The pharmacy unit has its own administrative system. The care management unit has its own administrative system. The utilization arm has its own administrative system. So there's already a distributed control to each unit of the whole healthcare system. So this already means that if we do not find an integral way to get all the administrative heads of each of these well interdependent units to work together, then we're going to cause, more fragmentation, more variance in care, more waste and delay, and then more friction. I'm sure you know that there is a lot of interprofessional rivalry in healthcare, which is one of the critical things the healthcare system has to deal with. And then when we talk about non-linearity of outcomes, this might be very clear. Normally, cause is supposed to lead to effect, isn't it? But it doesn't always happen that way. Why? Because there are a lot of interplay from different hierarchies in the system that could actually either augment the issue or reduce the impact of the effects that you would have. So because it is non-linear, a lot of times feedbacks are delayed, feedbacks are dynamic. So even if I've done something wrong, I probably might not know the immediate impact of what I've done until maybe 10 years later, because feedbacks are delayed, and this is leading to more trouble in healthcare until we now have a legal sanction. Then we start investigating, and then we discover that it was only a change in the administrative fee of laboratory services that actually triggers down, if you do a detailed root cause analysis, for you to find some linkage between that and maybe one or two other variables that will now complicate into the death of a child on the ward. Just a change in the cost of a medication, just an administrative altering of a process by positioning the pharmacy in a wrong place where the patient had to walk almost maybe miles, or if possible to get the medication, or if the thing is not well organized and designed with a lot of empathy for the patient, then it becomes an issue for the patient to be able to procure the medicine, and then that leads to a delay in providing the medicine to the patient, and then that leads to death of the patient. And so if you look at the whole system design, you're having a structure issue, you're having a process issue. These are designed to impact on the outcomes of care. So if we do not think about the non-linearity of outcomes, interdependent of agent, and distributed control in all our analysis, we will just be joking about building a transforming health system. So I want transformational leaders who will be able to identify problems and their system-based root causes. That is these are the summary of everything I want the transformational leadership mind to do. However, how do I get a boy to become a matured mind? You know, that is the essence of my whole story. I want to get everyone who is going to lead in healthcare to shift from the mindset of a boy to the mindset of a matured, transformed leader who sees healthcare holistically, at least at the whole level, at the systemic level. We also want people who are able to develop strategic plans and come up with interventional designs that are actually practicable in their environment. So it's not just about designing something, it's about designing something that is fit for purpose, fit for culture, fit for context. I'm talking about fostering integration by continuous engagement and education. I'm talking about transformational leadership mind that can adopt implementation science and use it to power improvement, consistently, innovations, and transformation. I'm talking about a capacity to evaluate, to adapt, and to stay resilient. And I'm talking about a capacity of leaders to be able to scale up impact where needed. You see, we need health systems that enable provision of higher quality and safe healthcare. We need it to reflect the population needs, the needs of the people. And then we need healthcare systems that will facilitate better assessment and management of population health. These are gamut of challenges, the gamut of areas where challenges can flow in healthcare system. As well as these are also areas, if properly strengthened, they can actually improve our healthcare system. I will not go into this. I know it's a busy slide, but I will just need you to just read through them one by one, and you know each one of them can actually lead to challenges in healthcare, as well as if we're able to integrate and study them properly as a transformational mind, we will be able to drive them to our advantage. So, when I say the system has dynamically distributed complex factor, for us to build transforming healthcare system, we need to first ask ourselves, what are the crucial problems that we need our healthcare system to solve? The first one is the issue of fragmentation of the system. You see, even by mere dividing the healthcare system based on federal, state, and local authority-driven system, we had already fragmented the layers hierarchically. Let alone within the system itself, we could actually horizontally fragment it into different arms based on the services that are being provided. So this fragmentation leads to issues making each system wants to stand alone, have its own independence, instead of seeking interdependence that would actually help the patient to achieve continuity of care. So the second one is overwhelming data on preventing medical errors and second victims. Of course, medical error is what happens to the patient. Second victim is the healthcare provider who is actually involved in the process of the medical error. There is inappropriate variance. Of course, it's not news that we have a lot of inequity in the healthcare that is being provided. Even within the same community, there are different strata of people and strata of access to healthcare, which is not supposed to be. We know that there's horrid waste in health system delivery process. There's a lot of waste in terms of resources. There's a lot of waste in terms of delays. And then I also need us to remember that there are interdisciplinary, interagency, interdepartmental, and interpersonal frictions that happens in healthcare. Between, even as simple as between a doctor and a nurse, between a nurse and a pharmacist, between a nurse and a nurse assistant. All these are issues that needs to be dealt with if we are going to build transforming healthcare system. There's poor proactive disease management. There's increasing consumerism. Patients and family are now demanding right to own their care, of which healthcare providers are not prepared to even deliver that kind of care. So now there's public pressure demanding for increasing quality of care, and even the system itself is not positioned for that. Now the worst part of it is that conceptually we have lost trust. The society had even lost trust. You will go to some communities, they have abandoned their healthcare facility. You will be so surprised. People prefer to go and, in some regions of the world, some people even prefer to go and deliver in a faith-based system than come to the healthcare system that has licensed staff. This is simply not because they are more faith-based people. It's simply because they had more trust in the faith-based system to help them than the kind of care or the kind of disposition, the kind of conceptual brand that our healthcare system had successfully given them. So to go into this course, we'll be using this book. It's called Transforming the Impossible. Because if you look at the gamut of the things I just listed in the last slide, it looks like to build a transforming healthcare system is the gamut of impossible. So if you look at this book is speaking to incorporating the 9 agile quality mind for leading sustainable improvement, innovations, and transformation. This is in this book I would expatiate more, but just looking at this framework alone, you would see the kind or the quality of mind that we need for anyone who would lead healthcare system, who would not be a boy, who would be a matured mind, who would be able to see through everything I've listed as challenges and still be able to embrace the possibility mindset to go about design thinking, to go about complexity thinking into systems thinking, and be able to deliver implementations that are fit for purpose. So for my book, this is the author's mind. Every time your mind shifts, your world shifts. And the great solution to all human problem is the individual's inner transformation. If I'm able to get every leader across different systems to have a transformed mind, then the integration of all the healthcare system and the capacity to start solving our problem at scale and the capacity to bring empathy into creating solutions, the capacity to bring design thinking into solving the problems into solving the uncertainty in the system, and then the capacity to also be able to scale such impact will start increasing rapidly. So I define transformation as a complete change in the quality of outcomes and the standard of living of an individual and a people. And I want you to pay close attention. Now you will get the reason why I started with the story of the immature boy. Because the first thing that happens to you when you become a transformed mind is the maturity of your mind. And these are the key things you would notice. The way the leaders will see will be different. You see, everybody can look, but what we see will be different. What I want you to note is that for every decision you make, there are things that are happening, that are changing. There are some things you will see vividly, clearly, obviously before you, but there are so many things that it will take a trained mind to see. And that is why we need leaders who are actually trained in the heart of assessment, in the heart of seeing, in the heart of understanding the consequences of whatever they're doing. That the fact that I altered this process today and I did not see an immediate result does not mean I have not created a problem. There is a blunt end to quality issues, to medical error, and there's the active end to it. It is the day the active end happens and someone gets to die. Maybe there's a fatality, or there's increased hospitalization, or there's life-threatening issue, or there's a congenital or maybe a birth defect, or we now have an important medical event happening, or when a legal issue happens. That is when we start running about. But an informed mind, a transformed mind, can trace it back to the day a decision was made in the boardroom, a decision was made at the ministry level, a decision was even made by the president of the nation. For every president who has not committed to the Abuja Declaration, is not even ready to commit 15% of their budget towards healthcare, I still wonder what we're doing. Because this means that we are not even yet seeing the implications of what we're doing. Despite the WHO's 6 building block, where healthcare finances is crucial, because for you to drive every of the system, payment has to be made, cost has to be managed, and if we're not ready to fund it, then we're not serious about the transformation of our healthcare system. So we need leaders who are adept at allocation of resources appropriately, finances, time, energy, willpower of the people. These are leaders who would have demonstrated track record of character, of integrity. Because when you tell people to go ahead, they want to be sure that you have their backing as a leader. So the capability of the people will increase. That means the performance improvement in the system will be a crucial factor. Socio-economic values of the system, uniqueness in the environment, and the noble impact. If you study this carefully, you would have seen the traces of the 6 modules that I mentioned in this. So, for us to transform our healthcare system as a transformational leader, I want you to know that we must do a fundamental relearning, rethinking, and rebuilding. Relearning, rethinking, and rebuilding. We have moved from the traditional reductionist system of healthcare, where we believe that just go into a small healthcare facility, whatever happens to you will be a direct response of the doctor you saw, the nurse you saw. Now we have gotten into a healthcare system where there are complex procedures where about 30 healthcare personnel will be the one doing the surgery, where about 45 healthcare personnel will be involved in the care of a single patient. And so if we do not quickly think about integrating the system carefully, where the people, the processes, the technology, and even the healthcare environment is already integrated in a coordinated manner, then we'll be running isolated healthcare system that would be doing more harm. I think it was Napoleon that said it, that there are 2 diseases I'm scared of: the disease that comes from nature and the disease that comes from the healthcare system itself. So the healthcare system can actually kill. I'm sure you've known about Toher is Human, and that report ran through the world like a ravaging fire. And that report is one of the reasons that birthed so many understanding about healthcare quality, medical error, near misses, and so on. And so many articles have been written based off that report. One thing I want you to know is that if you will be transformational, there must be unmistakable change. Change from one state to another in your system. That is, there must be clear vision. This vision must be guided by strong ethical values. There must be coalition. We must build teams. We must build communities, and we must build armies for transformation. We must engage the power structure. That is why we must engage government. We must engage economic investors, power factors who will drive healthcare system. We must do this with sound discipline. So we need disciplined minds. Enough is enough where we get leaders into position just because they've stayed long in an healthcare system or because they are technically good. You know, there's the halo effect. The halo effect speaks to the fact that if I'm very good in one field, I'm automatically a leader across board. That is not true. We all know that by now. We know that for you to transform a system, we need strength of adaptive leadership and we need excellence of technical knowledge. Integrating these two together, and so many researchers have even said adaptive leadership is 70%, technical excellence is 30% for you to change a system. So it means we need leaders who are more matured, who are men in adaptive leadership, which would in turn lead to transformational leadership. We need monitoring and evaluation. We need to define clear KPIs. We need to stay accountable, and we need to run transparent system. And that means we must have a transparent dashboard by which everyone is measured. We need wisdom because we need continuous learning, transformational education, and we need to keep driving research and development. We need positioning for divine and the supernatural. I will not deceive you. Once you set your mind on a transformative journey, you would hit opportunities along the line just like you will hit resistance along the line. And those opportunities, you must build strength enough to maximize them to generate huge results. Because the resistance would also want to force you to do the reverse. The resistance will come to break your spirit. So because of that, you must maximize the days of quantum leaps to be able to achieve great results. There is the knife injury and healing process story of transformation that speaks to the fact that if someone has a knife injury, the true person that is helping the injured patient is the one who is able to stop the bleeding, who is able to help the healing process properly. Not just the one who says, let's say the knife injury is about, let's say, 5 feet deep. Whoever just removes the knife back by maybe up to 3 feet can say, I've helped him, at least I've tried. I've reduced the depth by 2 feet. And then someone else will reduce it by 1 extra feet and say, I'm helping. But the true person is someone who actually removes the knife completely, stops the bleeding, cleans up the wound, sutures it if possible, and manages it with proper sterile gauze, bandage, antibiotics, and everything, and is able to completely help. That is actually the full story of transformation. So when we are in defect, if you are creating minimal changes, even though they are good, they are not transformational. Until you're able to integrate the end-to-end spectrum of management of the system, that is when you're actually transforming the system. So as a leader, I want us to know that if you are the HOD of a department, your goal is not just to change the status of the department gradually by just removing the depth of the stab wound from 5 feet to maybe 4 feet or to 2 feet. Your goal is actually to change the system. So let's stop thinking. You can start by removing it gradually, but the goal should be rapidly in an agile process to ensure that you're able to build huge system. So if you look at it, transformational growth is from internal to external. That's the first thing. It drives improvement in competence, character, compassionate, courageous, and consistent complexes. I'll talk about the 5 complexes soon. And then if you ever follow the opposite course and think you want to design from external to internal, you will result in purposelessness. I can promise you that. And then if you want to change something, you must think about a different culture, a different system. And the goal is always to yield a new behavior, new set of tools, and new set of processes. So that's what I'm saying. If you just remove the knife just a bit, you would say, I've done something. And I appreciate you, you're doing something. But what I want is actually transformation, not just change. I need those changes to come in a rapidly designed phase Understanding the whole end-to-end concept so that you can build transformation as quickly as possible. Transformation is for the people. That includes you as the leader, the processes, and the system to become something different by introducing and reinforcing completely new mind capacities, culture, attitude, expertise, capabilities, and performance outcomes. I spoke about the 5 complexes, but I need you to understand something. For you to transform any person, you must be able to move them from being a conforming mind to a transforming mind. That is actually your job as a transformational leader. And don't forget, in any system, transformational leader will lead the people. You must lead the people from being a socialized mind to being a transforming mind, and you manage the system. You do not manage the people and lead the system. That would be a reverse order. The standard order is for you to lead the people and then manage the system. In the process of leading the people, you must understand that you meet some people as conforming mind, you meet some people as evolving mind, and you will find some people already getting to the scale of transforming mind. You need to build coalition of people around transforming mind to help the evolving minds to become transforming and get the conforming minds to start moving towards transforming. You can see that the graph is not straight. It means that you're going to have a lot of issues along the line. There will be some days of good news and some days of very, very not so good news. And as you go through those Kubler-Ross change models, all these depressions are valleys of despair. Your job as a transformational leader is to reduce the depth of this valley of despair. So it's not like there are no valley of despair at some point, but you are able to work more to prevent you from really going deep down. So that is your job. There will be days like major global crisis like COVID-19 where it might hit so badly and you go this down. But there are days where you recover and come back up. That is your role as a transformational leader. So you're not just in leadership to effect small change. You are in leadership to deal with 5 complexes based on this. You are bound by character competence complex. You are bound by competence and clarity complex. The reason why we call you a competent person is that by the time we're explaining a solution to you, you must have some degree of clarity. If you don't have clarity of what the solution to the problem is, you have clarity of who to gather together, consultants to consult, who to ask questions, the right questions to ask. At no point should we meet you as a competent leader and you will tell us you don't know anything. You must know something. You must be able to tell us what's the next step, an idea, who to ask, who to consult, who to inquire from. Is there a subject matter expert? Can we talk to someone? Can you quickly gather a meeting together? Summon a meeting? There must be something. Then courage and competence complex. You must be courageous. There are some things, it is the high of your courage that will pick it first before even the competent eye will be able to capture it. You must have the compassion capacity complex. I always say this jokingly every time. If you do not have the capacity to help, you are just pitying the people. You are not compassionate. You're only compassionate when you have the capacity to help. If victims come into the hospital now, if they bring them into the ER, it is the doctor, the nurses who have the capacity to help them that are actually compassionate. Any other person that is just trying to run up and down probably will not help them. And there's also the consistency complex. So this is the full Kubler-Ross model, just for you to see. There is the range where you actually get into the valley of despair, and that's the point where you decide as a leader to either quit or to brace up with grit and start going upward. When you brace up with grit and you start going upward, and these are critical leadership and system support level. If a transformational leader misses this point, you will not be able to get your people to mastery, and then you would have lost the people. So I want you to know that there are a lot of battles against transformation. At personal level, you would have issues. At system-based levels, you would have issues. The first one is your own fears, doubt, and anxiety will kick in at many points. You have your own habits, vices, and behaviors to deal with. You also need to know that there's a dominant culture of fitting into the norm. People just want you to seek pleasure. They want you to seek fun. They want you to use that to sabotage the future. That is what the people want. But if you as a leader is already disciplined and a person of character, it will be easy to set that ideal character framework for others to follow. The system-based part of it is that there are diverse opinions and interests across multiple stakeholders. You would have challenges with communication. You will say something right, and people will tell you it is not about what you said, it's about how you said it. and that would lead to more trouble. So you would have the inertia to continuously learn, to grow, to collaborate, and to develop new capabilities. You will have the challenges of identifying causal and associated factors and interdependencies. You would have to deal with rapidly changing world order. We live in an hyper-connected generation. Explosive computer power is actually another issue plaguing us technologically. Then demand for achievement of big outcomes in good and bad seasons is also another major issue that you would have to deal with as a transformational leader. So as I wrap up now for this first section of the first module of this course, you must understand that we're going to be dealing with the living mind, the loving mind, the leading mind, the learning mind, the listening mind, the laughing mind, the lean agile thinking mind, the leveraging mind, and then the leaping mind. Thank you so much for listening.